Welcome, everyone. I'm Paul Flatto, the Director of the Centre for Social Impact here at UWA. And we have an incredibly important seminar today with Professor Pat Dudgeon. Let me begin first by acknowledging that we're on Whadjuk Noongar land here in the campus, Crawley campus, and pay our respects to the elders of this land. So as I mentioned, this is a very important research seminar for us with Professor Pat Dudgeon, a Bardi woman from Western Australia, psychologist, professor at the Poach Centre for Aboriginal Health and the School of Indigenous Studies here at UWA, as well as director of the Centre of Best Practice in Aboriginal and Torres Strait Islander suicide prevention. And that, of course, is the focus of today's seminar on Indigenous social and emotional well-being and suicide prevention. So that's the topic of today's seminar. So welcome, Pat, and we're all very much looking forward to this presentation.
Okay, thank you, Paul. I don't know, my screen looks the same to me. Is it doing the right thing for you?
And it's doing marvellous, yeah.
Oh, thank you. And Melissa, can you put the first PowerPoint? I'm unable to do my PowerPoints, everyone, so bear with me when I yell out next PowerPoint as we go along. But thank you, the Centre for Social Impact. I'm very pleased to be here for the webinar, presenting on some of the work that we've been doing. So thank you. And next PowerPoint. Like Paul, I'd like to acknowledge the traditional custodians of the land that we're meeting on today and pay my respects to the elders, past, present, and to all Aboriginal Torres Strait Islander people. We recognise that our work in suicide prevention and social emotional wellbeing stands on the shoulders of our leaders and our ancestors who continue to advocate for our culture, strength and resilience. We value the support of our allies as well as we walk together towards social justice. So just a bit more, as Paul described, my people are from the Kimberley, up the northern coast of Western Australia. I was actually born and grew up in Darwin, and I say all the time that part of my heart belongs to Larrakia country. But my people are from the Kimberley area. They're Bardi. I'm from the Bardi people, and I've lived and worked in beautiful Noongar Budja for more than half of my life. So I actually came down to Perth originally to Balloo to study psychology back in the day when Darwin didn't have a university. So that's telling of the time that I've been around. But next slide, Melissa. So as Paul described, I want to talk a bit about my work with suicide prevention, but also the emergence of different Indigenous knowledges, paradigms, social emotional wellbeing being one of them. But before I talk, I'm always compelled to do a little history of what's happened for Indigenous people in this country. We can't discuss anything about Indigenous issues without that history, I believe. So we know that Aboriginal culture has been around for 60 to 75,000 years. It is an old, a very rich culture and history, recognised as the oldest living culture in the world. We know that colonisation has been very recent, about 200 years ago, and that's led to frontier wars and genocide, forced removal of Aboriginal peoples from their country and dispossession of land. So there's been a terrible, dark history that of the First Nations people of this country, but also of other countries across the globe, which I'll talk to later, because we share many things. But in the background of that dark history, we need to acknowledge that there is survival, strength, and resilience. We know that prior to colonisation, there were 250 language groups and cultures right across the country, and these are now being reclaimed. The recent Australian Bureau of Statistics show that there's nearly 1 million Aboriginal and Torres Strait Islander people across the country. That's representing 3.8% of our total population. Next slide. However, things are not good. So despite some of the great changes and positive changes that I've witnessed in my time, we also see some very serious situations coming about. Suicide is one of those. When I was young and growing up, either it wasn't talked about, but suicide wasn't as prevalent in our communities as it is now. And we know that suicide accounts for 5.5% of deaths amongst Indigenous people. It's the second leading cause of death for our Indigenous males and the 10th leading cause of death for Indigenous females. So suicide accounts for 21% of all Indigenous child deaths. Next slide. I think that a picture paints 1,000 words, and this is one that I do like using. This graph showing the Indigenous suicide rates and the non-Indigenous suicide rates. So, you know, we know that, and this has been consistent, the high rates. The overall rate of Indigenous suicide is 3 times that of other Australians. So the red line is actually the Indigenous suicide rates, and the blue line is non-Indigenous suicide rates. So it's become a very big issue, and most families, including my own, have had the experience of one of their immediate and or extended family members taking their lives. So it's something that we really have to grapple with, and I don't think there's any magical quick answers. And some of them, you know, we've explored possibilities, and I'll share some of those directly. But next slide. Our team actually working with the Australian Institute of Health and Welfare have broken the suicide rates down to by state. And so in Western Australia in particular, people, this PowerPoint is public property. So once the webinar's over, the Centre for Social Impact can share them to whoever wants them. So yeah, so you don't have to furiously write things or take photos or whatnot. I'm arrogant assuming that people will be doing that. But anyways, as you can see, that's the suicide rates across the country. Western Australia is up there. We have very high suicide rates. South Australia was a surprising outcome, and they have a very high suicide rate as well. Earlier this year, I presented in South Australia at the Australian Indigenous Psychologists Association conference, and because it was in Adelaide, there were lots of South Australian people there, and they were very shocked about these numbers. So I think we do have to pay attention to numbers. They're probably underreported though. Stats are, you know, they're good, and we need them, but sometimes they're not always correct. And our feeling is that this Indigenous suicide rates are underreported. But next slide, thanks. We know that there's great disparities in mental health and wellbeing. So we know that the age standardised rate for Indigenous suicide is 33.7 per 100,000. And in 2022-23, 3 in 10 Aboriginal people experience very high levels of psychological distress. So there's really good surveys that go out. They're not perfect, but they give us an indication of what's happening nationally. And that enables us to have an understanding of what's happening right across the country and where resources and attention needs to go. You know, that we know that there's very high levels of psychological distress. We know that Aboriginal Islander youth almost 2 in 3 experienced significant stresses and adverse life events. So that's a big number. And with experience of racism, and that's just increased dramatically, that 34% of Aboriginal Torres Strait Islander people have reported that their experiences of racism have increased significantly. So I think in previous presentations it was a smaller amount. And we're seeing the cause being the referendum. I think things happened during the process of the referendum, or the lead up to the failed referendum, that enabled the expression of racism. So that's another stressor that our people have to contend with. Next slide, thanks. You know, when I do talks, people say, well, why? Why is there such a high rate? And I don't think that we can be too simplistic about it. I think each suicide is one person who's chosen not to be with us, whether they're Indigenous or non-Indigenous. So I think that it's not always helpful to sit back and analyse it without acknowledging our humanity. But for Indigenous people in particular, there's a bunch of different, or a matrix of different reasons that might contribute to the high suicide rate. You know, there's ongoing exposure to socio-economic disadvantage and multiple psychological stresses. There's grief from premature deaths of family, community members and friends, including suicide. There's violence and interpersonal conflict, transgenerational trauma, pervasive racism and discrimination, a loss of sense of purpose in the meaning of life, relationship breakdowns, poor health, and also there's an access gap to mental health services. So there's not the culturally appropriate or culturally sensitive mental health services around that need to be there. So the next slide. This is not our issue alone. So this is outdated, this map. So if you want to have a look at it, please do. But with the proviso that it is very outdated. So some years ago, we hosted the World Indigenous Suicide Prevention Conference here in Ballou in Western Australia. And before we brought everyone together, because we had people coming from all different parts of the globe, and New Zealand had hosted the first conference, we were the second. Since then, it's been held in Canada, in the USA, in Niagara Falls, and in November it returns to New Zealand again. But we were the second group to host it, and we decided to try to pull together best we could the suicide rates of Indigenous people globally. And it is a very similar story, a very similar struggle across the globe for Indigenous people, particularly in settler nations. And they're nations where Indigenous people are there, but they're the minority and have had a whole lot of process of colonisation impacted and imposed upon them. So we're looking at high suicide rates right across, you know, in the US, in Canada, in New Zealand, Australia, obviously, but also in northern Scandinavian countries where the Sami people are, and they've got horrendous suicide rates as well. So I guess the message in showing this, keeping in mind that it was a very amateurish attempt of trying to get a global picture, is that there's the same situation is prevalent across the globe. And we've been talking to our Indigenous brothers and sisters from other countries at the IEPA conference earlier this year on suicide prevention and social emotional wellbeing. We actually had Gail Morse, a Hawk psychologist, present. So we've been, and we've got particularly if you're in Perth, we'll be having Dr. Mark Standing Eagle Bayes and his wife Alison Bayes presenting on the 4th of July at UWA. So that's an open lecture looking at different Indigenous or Native American research methodologies. So one thing good that's come out of this very fraught situation is that we are starting to connect globally with our Indigenous partners on suicide prevention. Next slide. Oh, is that the next slide? Oh, yes, it is. Duh. Sorry, it was me. My brain went on a bit of a blank for a while. One of the good projects that we were involved in and that I'm particularly proud of is the Aboriginal Torres Strait Islander Suicide Evaluation Project. And that was a big project that spanned a couple of years. And it was at that time, this is back in about 2013, the suicide rates were increasing, and the government was at a loss of how they funded Indigenous suicide prevention. So they commissioned us at UWA to undertake the Solutions That Work report that we did. And we concluded there that Indigenous suicide is different, but it has many causes, including cultural, historical and political issues and other considerations, but it is different. Indigenous suicide, the ATSIPAP was initiated to develop an evidence base of what works in Indigenous suicide prevention. And we completed that in 2016 and launched it at Parliament House. And it has had impact, thank goodness. Next slide. Because one of I won't meander off until later. Our aims of that project, and there was this a fabulous group of people who are involved. Myself, Jill Milroy, who's a Deputy Vice Chancellor at UWA, Professor Tom Calmer, Yvonne Luxford, Professor Ian Reid, Professor Ros Walker, Adele Cox, Jerry Georges, and Chris Holland. So there was a really good team of Indigenous and non-Indigenous experts who undertook that project. But our aims were to prioritise Indigenous ways of working, to strengthen the evidence base for Indigenous suicide prevention, and to develop an Aboriginal Torres Strait Islander cultural framework for suicide prevention services and programs. Next slide. It was based on rigorous Indigenous-led research and extensive knowledge derived from a large number of Aboriginal Torres Strait Islander voices and credible sources. So we did a big comprehensive national and international literature review to find out what works in community-led Indigenous suicide prevention. We did 69 community consultations. We did 12 specific round tables, and we chose topic areas like Indigenous youth, LGBTIQ issues, because within the vulnerable group are other vulnerable populations. We looked at all the suicide prevention strategies that were operating at the time, and we had a number of key themes and recommendations. We also talked to, at that time, our peak body was the National Aboriginal Torres Strait Islander Mental Health and Indigenous Leadership Group. It's now morphed into a very professional and very respected group called Gaia Dewey, Proud Spirit Australia. So this is back in 2003, and things have changed for the better in some regards in terms of the inclusion of Indigenous leadership at all levels in suicide prevention. But next slide, thanks. Okay, so basically the report came out with 17 key recommendations. and 35 success factors. So there needed to be a holistic, systematic framework for commissioning service and communities to create locally relevant community-led solutions. And the big messages or elements that successful suicide prevention program should have is one, the principle of self-determination. So all the funding should be directed towards Aboriginal and Torres Strait Islander community-controlled bodies. And it's weird saying this now because that was not happening back then. Now we've got these fantastic programs and strategies, and self-determination is a key tenet in those. But the principle of Indigenous governance with ARCHOs, they're the preferred facilitators, and Aboriginal Torres Strait Islander people in positions of authority on boards, committees, as well through community empowerment, ownership and employment. A holistic approach to suicide prevention was recommended through social emotional wellbeing, cultural strength, involvement of elders, promotional of cultural competence and trauma-informed care, addressing to the social determinants of health. Next slide. The key messages of the levels of intervention is that we took a population health approach. So there's not going to be one approach that suits every situation. So we suggested that there needed to be universal interventions. So if we could increase the resilience of everyone, then there'd be less suicide, less domestic violence. We could build up a resilient population. So that's been one of our issues too. And some of that includes, programs that strengthen cultural identity. And that is considered a protective factors. There's selective interventions that target groups of people of high risk of suicide, and they should include postvention services and programs for high risk. And as I mentioned before, we are very concerned about youth. You saw from the charts that men are also at high risk, and it's fabulous to see the men's movement starting to gain momentum, and particularly Ted Wilkes, Professor Ted Wilkes, who works with us, is leading men's social emotional wellbeing. So there needs to be attention given to the vulnerable groups within our vulnerable groups, and there needs also indicated interventions to those identified as being at risk of suicides or who have attempted suicide, and that includes crisis phone helplines. And we know nowadays we've got caller the 13 yards suicide crisis helpline, and treatment and management of suicide behaviours and follow-up support after suicide attempts. So a lot of strategies now, next slide, have been put into place. And it does feel a bit weird speaking back to 2013, but some massive changes have occurred. Our key messages were one, suicide prevention and suicide needs to be considered from community control, empowerment, self-determination. So projects need to be grounded in community, owned by community, based on community needs and accountable to the community. They also need to be holistic, so based on Indigenous definitions of health and social emotional well-being, incorporating spirituality, culture and healing. They need to be sustainable, strength-based and capacity building. They should mainstream services needed to work in genuine partnerships with the local Aboriginal Torres Strait Islander people and other providers to support and enhance existing local measures. There needed to be safe cultural delivery, and also there need to be innovation and evaluation. And we're seeing that happening. There's some fabulous projects, programs that have been established. I'm thinking off the top of my head of the equine therapy project that Professor Julie Coffin offers up in the Kimberleys, and the big NACCHO, or National Aboriginal Community Controlled Health Organisation, Culture Care Connect program. So there's these different programs coming out, but also ones that are national and work closely with the community. So ATSIPAT was successful. It actually has gone somewhere. When we launched it, I was thinking, as we launched it, is this going to be one of those reports that gathers dust in Parliament House and people use as door stops rather than, does anything that makes a difference? But it has made a difference. I'm very pleased about that. And in the latest National Aboriginal Torres Strait Islander Suicide Prevention strategy, ATSIPAT and its messages are very much central to that. We actually do have at the end of the PowerPoint, we have a link for all the different resources that I'm mentioning. So if you want to read more about them, please do. But Guy Dewey, our relatively recent peak body on Indigenous mental health and suicide prevention, was responsible for developing the National Suicide Prevention Strategy. They also have a Guy Dewey implementation plan, which is very much about Indigenous leadership, and policy making, and particularly its focus is for mainstream organisations. And finally, and I might not be doing it justice, but do read it. But finally, and waiting in the wings, we have the social emotional wellbeing framework. So this is its third, it's getting ready for the third iteration, and that's all about social emotional wellbeing, and it has gone back some years, and that it will be launched later on this year by Guy Dewey and the relevant government departments. So that's probably been our guiding light, the SEWB framework. Next slide. Oh, and the thing is that if we could implement all these three different strategies, a great difference would occur. So the suicide prevention strategy draws on the work of ATSIPAT and sets a path for all governments to work in partnership with communities to reduce suicide and self-harm. Next. And its priorities are leadership and self-determination, thriving communities, informed and supportive communities, culturally safe, accessible, coordinated care, responsive workforce, and evidence and data. Next. The Guy Dewey framework focuses, and it's designed to help all stakeholders work towards culturally safe, responsive, self-determined mental health system. And its key 5 themes are cultural strength, best practice, best evidence, Aboriginal Torres Strait Islander presence, Aboriginal Torres Strait Islander leader and influence. So that's a very important document for us. But as I said, that 3 of them need to be implemented, and they will make a big difference. And the mental health, social emotional wellbeing framework, that started some time ago, and it's recognised strength and resilience and diversity of Aboriginal Torres Strait Islander communities. It acknowledges the different cultures, history and needs of Indigenous people, but issues must be addressed by locally developed specific strategies. It's been revised and updated, and the sector looks forward to its publication. Next. And now that's a good segue. I'm not sure of my time. I think I've got about 10 minutes. So I'll fast track it because I do want to have a bit of a discussion. one of the big issues or paradigms that have emerged from our work across the board is social and emotional well-being. And I think that it is an important concept because Indigenous health should be viewed in a holistic context. So it includes body, mind, emotions, spirit, family, culture, country, and community. And we know that when all these the harmonies of these interrelations are disrupted, ill health will persist, and distress in one area impacts on the whole. Now, colonisation has had a cumulative impact on the social and emotional being of Aboriginal, Torres Strait Islander people in communities. We know that government policies, such as a dispossession of traditional lands, the forcible removal of children from their families, disruption to culture and identity have resulted in complex intergenerational experience of trauma and loss. So if we go to the 9 principles of social emotional well-being that come from the Ways Forward report, that one, there should mental health, physical health should be viewed in a holistic way. So that's very important. That self-determination is essential in all health delivery services. Thirdly, that culturally valid care must guide assessment and treatment. That intergeneration, we need to recognise the intergenerational trauma from colonisation and the impacts on well-being. The 5th one is that the human rights of Indigenous people must be recognised and upheld. The 6th one is that racism and disadvantage negatively affect mental health. 7 is that kinship and family systems are central to well-being. The 8th principle is cultural diversity across communities, lifestyles and locations must be recognised. And the final one is that the strength and resilience that underpin well-being and connection to the environment needs to be recognised too. So Indigenous people, despite colonisation, are recognising their Indigenous knowledges and their Indigenous histories, and these are important protective factors. Okay, so the Indigenous psychologists came together, and back in the day, they took all the messages or information from the Ways Forward report and the first social and emotional wellbeing framework and put it together in this diagram, which has become very well used. And that was our purpose as well. We wanted to create information for our communities that could talk to their realities. And so this diagram, which no doubt some of you have seen, captures it, all those issues that I was speaking about. You know, if there is a concept of self, we're not, and I'm not even sure if psychology does justice to Western people, but the concept of self isn't just the mind and the body. It's more than that. It's our connection to our family and kinship, our connections to our community, our connection to our culture, to our country and land, and also to our ancestors and our spirituality. And around that, you know, we can't, you know, so many times I've had people say, oh, don't worry about the history, that horrible history. You know, we all should start from where we are now, which is really limited, because no one starts from where they are now. All of us humans come into the room with a history, with a culture that is very much invisible. So we do need to look at the history and what that's meant for different people. And so we need to consider the social determinants, that's employment, education, experiences of racism, historical determinants, you know, that process of colonisation and reclaiming of Indigenous knowledges that are starting now. the political determinants. So that impacts us. Decisions by the government impact on us, and cultural determinants that Indigenous people are in the midst of reclaiming culture in a very strong, positive way. Next slide. Now, so there's some examples. I'm not going to go through them all because I think I'm going to run out of time. But there's there's descriptions of all those different determinants, the positive protective factors, and the challenges and risk factors. So I'll leave that and I'll move on. Thanks, Melissa. So that's been our big work, has been in social and emotional wellbeing, because we feel that that is a definite way forward for Aboriginal Torres Strait Islander people. We're very proud that our SEWB framework or the SEWB diagram, and I would consider it a paradigm, has been well used by our people. So it's been useful for our people. It resonates. They feel that it describes their reality. So that was a great success and a good thing that happened for us. And I remember that we had worked on it. We'd actually presented the SEWB diagram to a conference of over 200 social and emotional wellbeing workers, and it was a scary experience at the time, because the people at that conference, all Indigenous, were not suffering fools gladly. And if there were people who were not staying with the theme of the conference, or were coming across as imposing a Western way, they pretty well got booted off the stage. So we were a bit nervous, and we thought, well, either people will like it or not. Everyone loved it. They wanted to workshop all the different elements. We've seen, when we were developing it, we presented it to other conferences of Indigenous health workers. We also, for the second iteration of the SEWB framework, the diagram went out as the national consultations took place. So we were really pleased to do that and just asked for feedback so we could refine the diagram, which happened. So we did amend it a little bit. We'd put connection to land, and everyone said, no, don't put land, put country with a capital C. And we had put holistic, SEWB, in the centre, and they said, oh, that's silly, put self in the centre. So the further edits were suggested by community consultations themselves. So we were really pleased with that. We feel that there's room for cultural exclusion, for Indigenous knowledges. It also acknowledges the history, because I think the damaging thing about Australia sometimes it's a denial. Now we call it truth-telling, but there's been a denial to talk about what had happened, to acknowledge that history of colonisation that's happened to Indigenous people. So those historical elements are very important. We move on from there, but without acknowledging what has happened and the apologies that have been given, unless we as a nation can't move forward without truth-telling. So those are very important elements for us, and we feel for our communities. And since then we've done a lot of work in the area. We work closely with Aboriginal community organisations, community health organisations. We worked very closely with the Kimberley Aboriginal Medical Services, and we're part of their social emotional wellbeing welcome guide for the Aboriginal workforce. Do have a look. You can scan it. So have a look and do go through it, because I think it's very good, simple ways of describing how social emotional wellbeing defines Indigenous realities. Another guide that we were involved in was a workforce wellbeing guide, and that focused on the role of self-reflection and self-care and safeguarding and promoting worker wellbeing, and that's emerging as a big issue for us in the area. a lot of Aboriginal workers, you know, they don't switch on at 9 o'clock and switch off at 5 o'clock. You know, they're part of the community, and what happens in the community impacts on them. So we have to be particularly vigilant about safeguarding their self-care and ensuring that happens, because they get burnt out very quickly, and there's already, you know, we need more Indigenous social emotional wellbeing workers. We need them to be trained. We need them to be nurtured and protected as well. So this is the start of one. So some of the self-care things, just sharing in case others want to do them, is, you know, that we should look at it across all elements of our self. So there's physical things that we need to do for self-care, and all of us know this. We probably don't do it though. You know, that you should be, you know, watching what you eat healthy, doing exercise, and also be in a safe physical environment. For us, yarning with elders, connecting with country, engaging in cultural practices and ceremonies is important for our spiritual well-being, and again in emotional well-being. You know, doing activities such as engaging in yarning circles, going to Indigenous activities, building emotional safety through trusted relationships, and connecting with loved ones, and so on. So there's a whole list of different activities that Indigenous professional workers could do, but I think they're messages for all of us, so do have a look at them for your own sake as well. Next slide. Another social emotional being bigger activity that we have done over the years is that we decide to call together all the people that were doing activities in social emotional being, and that forum or consortium, where UWA hosts it, we host it, but it actually involves Guy Dewey, Proud Spirit Australia, our peak body, the National Aboriginal Community Control Health Organisation, and also the Australian Indigenous Psychologists Association. So just recently we had our 6th gathering. So we've had the gatherings largely in Perth, but in different cities as well, in Canberra, Darwin, Adelaide. So we've moved them as much as possible. We will be having our 7th one, but it's important that we've come together to talk about different issues to do with social emotional wellbeing. We've had different themes for the different forums that we have. They're pretty big though. You know, forums sound small. There've been over 200 people at various SEWB gatherings. All the reports are on our website, so if you want to have a look, please do. Next slide. I'm conscious that my time's running out. One of the most recent activities that we've been doing is that we're developing a social emotional being training module for the community. So it's mainly for the Aboriginal medical services, but we've just gone through ethics approval now, and we'll be doing a pilot program in Darwin, Broome and Perth, after which the training program will be refined and offered out nationally to mainly Indigenous community controlled services, but also non-Indigenous departments who want to support their Indigenous workers. So we'll be making a lot of noise as that happens and after the pilots are done, which will be happening very soon. Next slide. Okay. I was thinking, oh, I'm going over time, so I think I'm going okay. This is some Aboriginal Torres Strait Islander SEWB resources. This is available for all of everyone who is here. And I think next slide is where you can take a photo and go to our social media. So do have a look at our websites. And follow us on social media. There's a lot of work coming out. we're merging the two entities. So the Centre for Best Practice and the Transforming Indigenous Mental Health and Wellbeing are merging into a new centre called the Corp-Born Janara Centre. So we went through we're just calling it the Born Centre, but we went through a quite a comprehensive and really beautiful process, sitting down with Richard Wally, Dr. Richard Wally, who's the Elder in Residence at UWA, and after lots of talks to our staff and stakeholders, came up with a Noongar name for us, and that means the roots of the trees are strong and interconnected. So we're very pleased with that. We've just finished doing our new branding, so do keep an eye out for that. Our name will be the Born Centre. And I think that's it from me. There's no more slides. And I would hand back over to Paul to have a conversation. This is conversation time now.
Fantastic. Yeah, so fantastic, Pat. Marvelous review of the work that you've been doing and your centre in terms of suicide prevention and social and emotional wellbeing. And I know that there's so much interest there, as represented by the fact that we had 196 people actually watching on. So well done. And another 400 odd registered. As Carol said, we'll have these recordings available and the PowerPoint ready for everyone relatively soon. So let me now open it up to questions. You can put a question in chat, or you can actually ask the question directly. If you want to ask a question directly, just raise your hand, and in the 15 pages of people, I'll try and find you. But yes, you can put a question in chat. So whilst people are getting themselves ready, so the development of the social and emotional wellbeing framework has been really very strong and lots of applications. I wonder if you could tell us a little bit about the implementation in terms of measurement and research and how one can measure that, and given the nature of it, it must be very, very broad and holistic in its approach in terms of measurement.
Yeah, and look, absolutely. We've been involved in some projects because I only cherry-picked some of the projects, but one of our projects was working with the WA Mental Health Commission, where we evaluated a pilot project that they did. I thought it was absolutely fantastic because they made a commitment to social and emotional well-being, but they sat down with our state affiliate, the Western Australian Aboriginal Health Services, and that is responsible to a number of AMSs across the state, rather, I was going to say country, and they actually went through a co-design process. So that was really important too, because I think the history of Indigenous everything has been that, you know, other people have good ideas of what should happen, and then they dump those ideas on the people, and then they don't work because the people weren't involved in them, and then the people get blamed rather than the not so good ideas that our external people have had. So I really appreciate the co-design process that took place, and it just shows too. So they committed quite a bit of money. 5 sites were chosen to increase the social emotional wellbeing offerings, and they've done really well. And there's been there was 5 originally, but a further 2 was added, and they've done brilliantly. And I think the whole that part of the AMSs has been refunded, and we evaluated that process. So that report's about to come out. But during that, our staff developed an assessment tool for services that are delivering social emotional wellbeing, and now we're involved in how do we measure and social emotional wellbeing. it is difficult. I think, there's things like what kind of services, and keeping in mind that they're broad as well, Paul. So I know that some of the communities up north say, there's no room or funding for back to country camps, which is important for us because that strengthens our cultural identity. So we need to keep it broad, but that is an issue as well. And I think the assessment tool that was developed also looked at the governance arrangements in any given organisation, that there is Indigenous leadership, that there is Indigenous workforce in it, and Indigenous decision making. So very important. And when that happens, Aboriginal Torres Strait Islander services do very well. But measuring it is going to be a challenge. I used to think you'd need a battery of different tests if I had different levels maybe to, there's the organisational level, but there's also individual. But I think with what I'm seeing emerge is in assessments, people are then using the SEWB frame diagram to do assessments, and it is very qualitative, but it might, and it depends on the individual. But I'd be checking off against, how's your physical well-being going, how's your are you your emotional well-being, do you have any needs, or do you want some interventions there? But then connection to family, to family and community. Oh, I forgot to mention, everyone, when I did the diagram, it looks like a nice pie with nice slices. The reality that it's all quite overlapping and mixed up, like any intellectual model. It's not perfectly, in its little precise bits and pieces. So I'd be assessing on, what community activities are you attending, probably with your family or representing your family. Are you going back to country? Are there opportunities? And it doesn't need to be your country of origin. It might be that as a Bari person living in Nyungar country, I feel happy when I go out to the country in Nyungar country. I still feel replenished as well. So I think that we just have those opportunities to go back to country. Obviously, country of origins probably preferred, but if not, just going out and reconnecting with nature and the environment's very important. And everyone should have opportunities to do that, and also to do cultural activities. Now, there was another an Indigenous psychologist colleague used to do a workshop on social emotional being with non-Indigenous clients. So just saying, for the people in the audience who might be saying, oh, that sounds so fabulous, but I wish I could do it. You can do it. I think it's not about, it's we needed our own model, but it's not exclusive. It does not exclude anyone. And my friend who was delivering it, I thought, yeah, well, that sounds like a good way to go, but how can non-Indigenous people have a connection to country? And his thought was that when we need to be replenished, we don't go into not many of us go into an urban centre for that. We actually go out and reconnect with nature. And he said, when you go into nature and you dig your toes into the soil, we connect immediately, no matter who we are, and we're all children of this planet, So I thought, yeah, it's all relevant for all of us. And our spirituality is very much a personal thing too, so how we practice that. But we should have some spirituality and some commitment, to the thought of there's a bigger presence or a bigger feeling in the world.
Yeah,
so
good.
measuring it's going to be a challenge, though.
Yes. And I think you've answered a couple of questions that we've had in the chat about whether the training is available for ACOs as opposed to ACOs, the community organisations, just general. Yeah.
Yes, that training. Tegan, we've been very fortunate. We had Tegan Schaaf developed. She's a staff member with us. So and we had a first meeting because we realised that, you know, most Aboriginal people in the services know what SEWB is, but they need an opportunity to articulate it and say, well, how does this impact on me, but also in my work. So we gathered together from that idea. We gathered together people from Danila Dilba, from CAMS, from Nacho, from the Darling Downs PHN, and anyone who we knew that were asking these, you know, were concerned about workforce, and that's how, and brought them together in Perth to in Boorloo to start developing a project. But it will be available not only for ACHOs, but ECHOs, or how do I say it? Aboriginal community controlled organisations, and also we think that we're going to have to make it available for mainstream services and organisations in due course as well. So we're hoping that the pilots will be done within the next, I don't know, 2 to 3 months. Going through ethics is, and we should all go through ethics, everyone. Yeah, but it does take time, so you need to build that into any project that you're doing. But it's important too to pilot it so we can refine it so it's meeting the needs of our mob. But it'll be available for everyone.
Yeah, fantastic. And by the way, you're getting a lot of messages of thanks from various people. So, for example, thanks, Pat, sending biggest mob love and appreciation for all you do from Yaru country. That's from Ali at Roebuck Primary School. So you've got a lot of messages, and there are a lot of further questions there. And some of those relate to the fact that you can adapt this approach for different points. So someone was asking about Noongar country, that over time there would be potential adaptations for different countries in Australia. And also ask the question of development of a measurement of spirituality, which would be interesting as well.
I think it'd have to be self-reported, but we spirituality, and it means different things, you know, for different people. So some people, you know, still adopt Christianity, which has been introduced, but it's been adapted to their own cultural ways. So I think spirituality is very much up to the individual families, and agree that model, the SEWB model, is does not supersede local needs. Local people have to drive everything, and you know, one of the in Indigenous knowledges, that's one thing we're very mindful of, is that there can be the big messages can be general and national, but at the end of the day, it has to come from local and regional people and communities, whatever the Indigenous knowledge is. And even when we were, when the ACWA and the Mental Health Commission were implementing the big SEWB pilot, the different AMSs had different experiences because they're all different and they've got different histories, different locations, different priorities. So, and the wonderful thing is that they had room for that difference and also choice. So, so I think that's important with whatever we do as well. So our role is to support, inform, encourage.
Yes, and so thanks so much, Pat.
I'm looking at all the thank yous.
Yeah,
thank
good.
you, everyone.
Excellent, excellent. So you're seeing a lot of that, and just coming through so much. I think, Carol, if we can get some of these thank yous out to you, you'll be really, well, not surprised. I'm sure you get that often, but it's absolutely fantastic. And the last one I've just read is from Gadigal country, Wurundjeri country, so far and wide today. And so thank you so much, Pat. It's been fabulous. And as we mentioned earlier, Carol will be sending out an email to 440 odd people to let them know this presentation is going to be held, and also the recording as well. So Thanks so much. Obviously, you can subscribe, by the way, to the Centre for Social Impact, and we've got our 5th anniversary coming up. Have a look out for that next week, actually. So thank you, Pat, and thank you, everyone.
My pleasure.
Thank you,
Paul.
Thank
Bye-bye.
you. Bye-bye.